So I think the major thing we're doing is planning and then monitoring the current situation. So what we're planning for is if we were to have a large-scale outbreak or anyone test positive in Kalamazoo County, we would want to make sure that we are protecting our first responders by using the appropriate personal protective equipment and making sure that our first responders, number one, don't contract the virus, and number two, are not carriers throughout the community. You know, at the end of the day, no matter what is going on everywhere else, we have to ensure that we provide police, fire, and EMS services to this community, and we have to have the staffing to do that. So a lot of our planning is around how we keep our first responders safe and then how we continue to provide those services as we work our way through this pandemic.
And would you be able to go into any detail about exactly what you all are doing to keep your officers safe?
So some of the things we're doing to keep our officers safe is, of course, we've put protocols in place that they're wiping down their workspaces, their vehicles that they operate in. We're also providing them with extra masks and gloves and eye protection that can be used on calls or during situations that dictate the need for that extra equipment. But I think what everyone also needs to know is because we as public safety officers respond to not just police calls but medical calls, that we really have to carefully evaluate each situation. We would never hold back any medical first aid anyone needs if it were a crisis situation, let's say a heart attack or something that we had to intervene immediately. We won't stop doing what we need to do, but we are going to evaluate situations a little more closely to limit the number of responders that are needed and also evaluate a little longer and maybe from a few steps back.